When you do the exam also, you'll only need to do one side. So you only do one ear, one eye, one nostril, and then like one lobe of the thyroid. So you don't need to do bilateral on either side. That also helps you with camera angles, so you can get your angle figured so that you can just see everything on that one side. All right, let's do the exam. The hair is brown, it's evenly distributed, there's no alopecia, and it's soft texture. Let me see your nails, please. The nail beds are pink and the capillary refill is immediate. The skin on your face is warm, it's soft, it's like brown, and the hygiene is clean, and the turgor is brisk. Then we'll check your eyebrows. The eyebrows are smooth, evenly distributed, and the eyelashes have no gaps. Close your eyes, please. The eyelids are smooth with no lesions. Open, please. Puncta is patent, and there's no exudate. The sclera are white, and the conjunctiva are pink. I'm going to check the cornea with an oblique light. Look straight ahead, please. The cornea has no haziness. And then we'll check cranial nerve 2, if you can keep looking straight ahead. Pupils are equal, round, react to light. And when I check the right eye, the left has a consensual response, and that's cranial nerve 3. If I could have you watch this and look in, that's convergence. Pull away, the pupils get bigger as the object is retracted, and that's cranial nerve 3. Then we'll do cover on cover, and if I could have you cover one eye, please, and look straight at this object, and then take your hand away, and the left eye did not move, so that's normal convergence. And then we'll check Hirschberg's, and the light reflex is the same place in both eyes, and that's good. Right, then we'll check EOMs and watch the object again. All right, good. And cranial nerve 4 is down into the nose, cranial nerve 6 is lateral, and cranial nerve 3 is everything else. And then we'll check the fundus, look straight ahead at that object right there. And I'm going to look, and I see the red reflex, and I come in and see the optic disc, straight ahead, don't move. And the disc margins are sharp. Very good. Then we'll do your ears, and I'm going to have you turn your head. The helix is in line with the lateral canthus, and they're symmetric. And there's a 10-degree posterior tilt. The external canal is clear. And is there any tenderness?
No.
So there's no tenderness to that auricle or the mastoid process. All right. Then look, and I see the umbo, and turn your head to the side, there we go. I see the umbo and the cone of light and the long process of the malleus, and at the top is the short process of the malleus, and there's no inflammation. Then we'll do the Weber test. If I could put this on your head. Do you hear that?
Mm.
Okay, this time close your eyes and tell me if you hear it most in the top or on one side or the other.
Top.
All right, that's the Weber, that's negative. Let's do the Rene. Tell me when you stop hearing the noise.
Stop.
Tell me, do you still hear it?
Mm-hmm. Yes.
Tell me when you stop hearing it.
Stop.
So the air conduction is 2 times longer than bone conduction, and that's a normal test. If I could have you put your hand over that ear there, the left one, and I'm going to stand back here, and I'm going to say a word. Potato. What did I say?
Potato.
That's just good, very good. That's cranial nerve 8. Then we're gonna check your maxillary sinus and frontal. Is there any tenderness?
No.
Good. The nose, the external alignment is good. If you could put your thumb under one nostril and sniff. And the nares are patent. All right, and I'm gonna check your nose. And the color is pink, there's no discharge, and I'm seeing the middle and inferior turbinates. All right, let's look at the mouth. The lips are smooth, the vermilion border is sharp, and they're red. Open your mouth, please. Tongue blade. The teeth have no obvious caries. The tongue and the buccal mucosa and the gums are pink and smooth with no lesions. Open real big, please. And stick your tongue out a little bit. There we go. Tonsils are, I'm gonna gag, sorry. The tonsils are, that's better, pink and smooth with, not smooth, they're normal tonsils. There's no exudate, and then posterior pharynx, I'm gonna have you take a big breath in. That's it. Posterior pharynx is pink and smooth with no drainage. And then let's look at the roof of your mouth. Hard palate and soft palate have no lesions. And then I'm gonna have you say ah. Very good. The uvula rises in midline, and that's cranial nerve 10. If I was going to do cranial nerve 9, I would touch the tongue blade to the back of his throat and gag him. But I won't do that. Then we'll check cranial nerve 5. There's a sensory and motor component. And, all right, let me do it on the back of your hand, please. This is sharp, and this is soft. And I'm gonna touch it on your face and tell me which one it is, sharp or soft. And close your eyes. All right.
Sharp. Soft. Soft. Sharp. Sharp.
Did I hurt you?
No.
Okay. Good.
Sharp. That's it.
Okay. And then I'm going to check the motor component of cranial nerve 5 and grit your teeth together. And I'm going to feel the masseters and the temporal muscles, and they're strong and symmetric. Then cranial nerve 7, I'd like you to smile, show your teeth, puff your cheeks out, close your eyes really tight, don't let me open them, okay? And frown. There you go, there's a lovely frown. Good. All right, then we'll check cranial nerve 12, and if you could stick your tongue out and up, inside and side, and down as far as it goes. There you go. Now we'll check the strength and push your tongue against your cheek, tongue against the cheek, and that's cranial nerve 12. Now we'll check cranial nerve 11. Hunch your shoulders up, push like straight up against my face. There we go. And turn your head towards my hand, and turn your head towards my hand. Good. And that's cranial nerve 11. Then we'll look at the neck, and the trachea is in midline. There's the hyoid cartilage, and then the cricoid cartilage, and then the isthmus lies right below the cricoid cartilage. And I'm gonna turn your head just a smidge down. Check the anterior exam and swallow. There we go. And you can see the isthmus rise and fall. Now I'm going to grab a little sip of water and hold it, and don't swallow it yet. And I'm going to check the left trachea cartilage, thyroid. Turn your head down. Then the cricoid cartilage, and the isthmus is right below that. And I did not palpate the thyroid on the left side. If I did palpate the thyroid, I would auscultate for a bruit. Now we're going to do range of motion. If I could have you turn your head straight down, and that's flexion, neutral extension, hyperextension, okay? And then lateral bending to the ear, to the shoulder, and then rotation, and rotation to the other side. That's good. Next are lymph nodes, and we're going to do the occipital, the posterior auricular, preauricular, tonsillar, submandibular, submental, posterior cervical, superficial cervical, and turn your head just a smudge so it's not too deep cervical, right there. Then hunch your shoulders up, there we go, supraclavicular and infraclavicular. If I were to palpate a lymph node, I would state the size, shape, mobility, borders, consistency, and tenderness. Next, I'm going to rotate you. We'll do the posterior chest. The skin is clear with no lesions, and there's no deformities. I'm going to auscultate, and I'd like you to take, excuse me, short, deep breaths through your mouth. Go when I touch, every time you feel me touch. Ready? Hold on a sec. And one more. Very good. And I'm going to check the respiratory excursion. If I could have you take a big breath in. And there we go. Release. Breathe out. And there's symmetric. When we rotate around, we're checking the AP diameter. Should be 2 to 1. On the anterior chest, their skin is clear with no lesions and there's no chest deformities. Same again, short little breaths. Check above the apices for sight 1. Big breath. And a little bit under your arm. Last one. Very good. All right. Now we're going to check the cardiac exam. We find the angle of Louis and come over it. And the second intercostal space on the right is the aortic, angle of Louis. Second ICS on the left is the pulmonic. Third ICS on the left is second pulmonic or Erb's point. Fourth to fifth intercostal space on the left sternal border is tricuspid. Fifth intercostal space, just medial to the midclavicular line, is the mitral area. Now we're going to do the same again and palpate and inspect for any lifts, heaves, or thrills. The aortic, pulmonic, second pulmonic, tricuspid, and mitral. And we're going to listen, auscultate. Aortic, pulmonic, second pulmonic, tricuspid, mitral. Now we're going to listen again and check with the bell on the mitral, tricuspid, second pulmonic, pulmonic, and the aortic. All right, that's it.